Have you ever asked yourself quietly, maybe late at night, is it still okay that I do this every day? Not out of guilt, not out of shame, just a question that lingers. You're not alone. Thousands of men over 60 carry this question in silence. We talk openly about blood pressure, cholesterol, even testosterone, but when it comes to self-touch, silence, hesitation, and confusion dominate. So today, let's say it plainly. What happens to your prostate if you masturbate daily after 60? Is it harming you quietly, as rumors suggest? Or could it actually be protecting you, and you've never been told why? We're going to break it down like a doctor would, no judgment, just truth. For decades, men have been told all kinds of things about masturbation. It drains your energy. It causes prostate inflammation. It might even lead to cancer. Here's the problem. Most of these beliefs are based on fear, not facts, and that's dangerous. When fear replaces science, men stop asking the right questions, suppress natural biology, and worse, they avoid things that are actually good for them. The good news? We don't need to rely on myths anymore. Today, I'll walk you through what real medical science says about daily ejaculation, prostate health, and aging, and show you why, in many cases, your instincts were right all along. One of the largest and most trusted studies on this topic comes from Harvard University, published in JAMA Oncology in 2016. They followed over 31,900 men for more than 18 years, most of them in midlife and beyond. The results? Men who ejaculated more often had significantly lower rates of prostate cancer. Men who ejaculated 21 times per month or more had a 33% lower risk of developing prostate cancer compared to men who ejaculated 4 to 7 times per month. This wasn't a random observation. This was a long-term, peer-reviewed study controlled for age, lifestyle, and medical history. No supplements, no gimmicks, just the data, and the data told a clear story. You might wonder, why would more frequent ejaculation lower the risk of prostate issues? Here are 3 reasons your urologist might explain. Ejaculation helps clear the pipes. The prostate produces seminal fluid. When you don't ejaculate for long periods, secretions can build up. This stagnant fluid may increase oxidative stress and inflammation. Think of it like a garden hose that hasn't been used in weeks. The longer the water sits, the more debris collects. Regular release flushes it out, keeping things clean and flowing. It reduces inflammation and cortisol. Ejaculation in a healthy, relaxed state lowers stress hormones like cortisol. Why does this matter after 60? Elevated cortisol is linked to chronic inflammation, high blood pressure, and impaired immune function. Studies show a balanced sexual rhythm contributes to lower systemic inflammation, especially important for men with enlarged prostates, BPH. Supports blood flow and pelvic nerve function. Just like your muscles need activity to stay strong, your reproductive system does too. Ejaculation helps maintain circulation to the pelvic region, reinforcing healthy nerve signals and vascular tone. As we age, blood flow naturally decreases, which can lead to functional and tissue health problems. A natural, periodic release supports the mechanics your body relies on. But here's the critical point. Frequency isn't the only factor. In the Harvard study, men with healthier ejaculation patterns also exercised regularly, slept well, maintained a healthy weight, and reported lower stress levels. Self-release was part of a larger picture of balanced health, and yes, you can do too much. But let's be real. If you're masturbating out of compulsion, stress, boredom, or anxiety, your body will tell you. You might feel fatigued, sleep poorly, or lack motivation afterward. That's when it stops being a health tool and becomes a stress response. If your body feels grounded, mentally relaxed, and physically healthy afterward, then your practice is likely aligned with your biology. It's not about numbers, it's about listening to your body. You might be thinking, I'm over 65, does this still apply to me? Absolutely. Most research applies to men in their 50s, 60s, and even 70s. Maintaining circulation, nerve response, and hormonal rhythm becomes even more important as we age. The difference? Your approach should be gentler, more mindful, less rushed. Release isn't just about pleasure, it's about maintenance. And your prostate will thank you. Masturbation alone won't fix everything. It's one tool in a much larger system that keeps your prostate healthy after 60. If you're releasing regularly but still eating inflammatory foods, skipping exercise, or sleeping poorly, it won't be enough. let's cover 5 key areas science says protect your prostate. 1. Nutrition that calms the prostate. Your prostate is sensitive to diet. One nutrient stands out, lycopene. Found in tomatoes, watermelon, and pink grapefruit, reduces oxidative stress in prostate tissue. High lycopene intake is linked to lower risk of aggressive prostate cancer. Other powerful foods. Green tea, EGCG anti-inflammatory, cold water fish, salmon, sardines, omega-3s, cruciferous vegetables, broccoli, cabbage, support hormone detoxification. Practical takeaway, consistency matters. Even a few servings of cooked tomatoes, watermelon, or green tea weekly can make a difference. 2. Daily movement to stimulate blood flow. Circulation is life. Sitting all day with poor posture slows blood flow to the pelvis, leading to stagnation, swelling, and poor function. You don't need marathons. Walking, gentle stretching, pelvic floor exercises, Kegel-style squeezing and holding muscles. Better circulation supports healthy ejaculation and prostate function over time. 3. Hormone balance through better sleep. Sleep isn't just rest, it's a reset. Testosterone peaks during deep sleep, poor sleep, lower testosterone, more abdominal fat, higher estrogen, more prostate inflammation. Practical steps. Cut screens 90 minutes before bed. Avoid caffeine after 2 p.m. Keep your room cool and dark. Try magnesium glycinate or tart cherry juice. Small changes in sleep can lead to big improvements in prostate comfort within weeks. 4. Reduce inflammation, the silent enemy. Chronic inflammation, prostatitis, causes pain, pressure, frequent urination, and interrupted sleep. Often systemic, driven by sugar spikes, stress, processed foods, alcohol, and smoking. Anti-inflammatory diet plus stress reduction improves symptoms more than medication in many cases. Healthy, mindful ejaculation can help, but only if the rest of your life supports healing. 5. Mental stress and shame. Many men feel shame around masturbation due to upbringing, religion, or social pressure. Chronic guilt increases cortisol, reduces immune function, and disrupts hormones. Mindful self-release without guilt becomes part of healing, not harm. Take a breath. Let go of fear. You're not broken, you're responding to biology. If you have blood pressure issues, diabetes, or prostate enlargement, moderate ejaculation is generally safe. It supports circulation, nerve function, and hormones. Consult your doctor if on medications affecting libido or vascular function, or after prostate surgery. Why masturbation matters. Not shameful. Supports prostate health, flushes harmful buildup, reduces inflammation, maintains nerve response, may lower long-term cancer risk. But remember, it's one piece of the puzzle. Diet, sleep, movement, mindset, and stress levels all matter. True prostate health is a lifestyle, not a habit. If this video helped you understand your body better, you're already ahead. But don't stop here. Watch the next video, Daily Habits That Protect the Prostate After Age 60. Hit like if this blew your mind. Subscribe and click the notification bell to stay updated. Comment below, what men's health myths should we bust next? Remember, age is not the end of vitality. Small, conscious actions, like gentle, mindful masturbation, good nutrition, regular movement, and sleep, can give you comfort, freedom, and confidence well into your later years. Stay healthy, stay curious, and I'll see you in the next video.